And welcome back. I'm Mabel Jong, and you're watching live coverage from the World Healthcare Congress here in Washington, D.C. This is WHCC TV. Thanks for joining us. I'm going to talk a little bit about medical tourism, the practice of traveling to another country for medical treatment. It's so popular that benefits consultants are having to bone up on the subject and try to find ways to offer it to their employees. Right now I have in the studio Tim Isenhower, who is Director of Benefits of HSM Benefits. Thank you so much for joining us,
Thank
Tim.
you for having me.
Well, tell me first a little bit about HSM.
Okay, HSM is a manufacturing company. We're about 3,000 employees, located coast to coast, 16 states, 50 locations. So we're spread out. So we're a spread out group in need of health care. We're in a lot of single hospital towns.
Okay.
So people don't have a lot of choices of health care where we operate.
Okay, so you're going overseas for some of this care?
We are.
How did that start?
Back in 2007, we were already paying healthcare claims in China and UK. We have expatriates in Lithuania and other parts of the world. And those medical bills would come to me, and I would see these medical bills that were so much lower than what I saw here in the United States.
Okay.
I just could never figure out how to facilitate, how to get somebody to go to another country to facilitate this surgery. So I found a company called Indus Health out of Raleigh, North Carolina. They were actually presenting at an HR conference that I attended. And from there we teamed up and have been sending hundreds and hundreds of patients from HSM to various parts of the world.
So back in 2006, employees were taking the initiative themselves to find health care elsewhere?
If they had no insurance, yeah, there was companies out there where they were contracting with uninsured uninsured people, citizens of the United States, that would just pay for their health care abroad.
Okay,
Yeah.
okay. So how do you do the due diligence on something like this? Whether these hospitals or surgery centers are reputable,
Yeah.
if they're going to do a good job, the safety issues?
Good question. When we started the program, we actually started in India, which is far, far away for our employees. We're manufacturing, a lot of folks, not highly educated, but they're manufacturing employees. So we found a hospital there. It was a joint commissioned hospital. It was actually had a Harvard affiliation. So with that affiliation that made people comfortable here in the US, I actually went to India and had a physical. Started 7 o'clock one morning, it was over by 1 o'clock. I had all my results before I left, things that would take a month to schedule here in the US. So they were very efficient. So we credentialed the doctors, we looked at their credentials, hospitals joint commission, so we started there.
Mm-hmm. So you actually have visited these places yourself?
Oh yes, I went to India 4 times and now we're going to Costa Rica. I've had surgery myself in Costa Rica.
Oh wow,
Yeah.
okay. So if another company wanted to start something similar, is that what it's going to take to really do, really make the investment to go visit hospitals in different places?
You most definitely do. I mean, you have to see it for yourself. It's not like the U.S. healthcare system. You go to these other countries and visit it and do what get a colonoscopy, do something that you're going to have done at a hospital. And that's a good example of how your patients will be treated.
Okay. How many different countries or different facilities do you have a partnership with now?
Right now, we're going primarily to Costa Rica. We also use Cancun for some prescriptions, and we have the Cayman Islands as well.
Okay. And if as I asked before, if another company wanted to replicate what you do, how do they start?
Call me. I don't know what else to tell you.
Right.
Find a facilitator who does it. I mean, you can be careful of the facilitator you choose. I mean, there's a lot of folks trying to do this out there. We use a company, it's called Indus Health. Like I say, they have nurse case managers. These nurses will screen the patients before they go, so we don't want to send a complicated case that may not do well when they get there. So you've got to have that screening process in place. So you've got to find a good facilitator.
And a quick word on how much you've been able to save with this kind of program in place?
When we looked at it, we started in 2007. In the first 4 years, we figured we saved $11 million.
Impressive.
And I think it's more than that now, a lot more than that now.
Really impressive. You presented today during one of our tracks on this very topic. Why present at this conference? What do you get out of participating in the World Healthcare Congress?
I'm proud of what we've done. Hickory Springs has just a fabulous benefit program. I've been on ABC News, we've been on Nightline. I like promoting what I do. I think it's a good program and I hope others do it. I'm not selling anything, I have nothing to sell. I just like promoting what I do.
And this is an audience that takes well to this kind of information?
They do. I had a good crowd this morning for a Sunday morning conference. It did very well. They had a good crowd there, a lot of good questions, and it worked out very well.
Tim Isenhower, thank you so much for your
Thank
time
you.
today. Really
Nice to meet
appreciate
you.
it.
Thank you.
And I'm Mabel Jong. Thanks for watching. Stay tuned. We have many more interviews to come.